Guess what, you guys? We did it! We finally hit 1,000 subscribers. And you know what that means? We're doing our giveaway. If you want to enter my giveaway, please go ahead and follow my Instagram at THEPSYCHDUDE. And on the third post, well, not the two posts that I just recently posted, but the one prior, I actually posted about our contest details and what to do to enter that contest. Make sure you actually go ahead and do those things, and we are giving away these two bad boys to 2 lucky winners. So one's gonna win one and the other one's gonna win the other one. And the actual contest ends on April 8th at 9 p.m. Pacific Standard Time, and at that time I'm gonna be doing that raffle, that giveaway. So make sure you enter, and make sure you don't forget to subscribe to my channel and like this video. I don't know why it went down, but make sure you like this video, and yeah, just continue this journey. I'm so grateful for all of you guys, and I appreciate everything you've done so far. Let's aim for 10,000 and upwards. So without further ado, I hope you guys enjoy this video. And in this video, I'm going to be talking about, can Psych NPs actually do therapy? And you'll be surprised by this answer, so stay tuned. Welcome back, Psych Dude family. It's good seeing each and every one of you guys today. So a lot of people are asking me, especially from people with different backgrounds besides nursing and wanting to get into nursing and wanting to become Psych NPs, their biggest question is, can Psych NPs do therapy? And honestly, this is a tough question to ask, because the main thing is, yes, we can do therapy, but are you prepared to do therapy? And that's the biggest thing. So upon entering nursing school or a nurse practitioner school, the biggest component that I've learned throughout the psych nurse practitioner program is, are you able to do therapy? And the answer that they told us was, yes, you are. But the main thing that we focus on throughout this program is the medication management side, which is important because a lot of employers out there are looking for prescribers, because that's the biggest need, especially in mental health, are prescribers. Are you able to prescribe? And the people that are only able to prescribe are psychiatrists, psych nurse practitioners, well, other spectrums in terms of psychiatric meds is what I'm talking about, is psychiatrists, psych nurse practitioners, family nurse practitioners under a psychiatrist, and certain psychologists that are trained in certain specialties in psychopharmacology in certain states. That's kind of a mouthful, but that's pretty much the gist of it. So there are not that many prescribers to amount of people that are actually providing therapy. There's so many people that provide therapy. There's social workers, there's MFTs, there's associate MFTs, there's psychiatrists, psychologists, so many different positions that you can provide therapy. It's just a lot of people are looking for prescribers. With that being said, this is the reason why they focus so much on prescribing medication during Psych NP programs. Luckily enough, in my component, I was able to do about not that many hours in therapy and just following a social worker and being able to provide therapy, but it's not to the certain extent that these MFTs or psychologists or social workers, the amount of hours that they have to put in. Which brings up the controversial issue is, are Psych NPs able to provide therapy? Yes, they're able to, but are they fully educated, equipped enough to actually help patients, especially if they're only seeing them once or twice a month? Twice a month is a privilege at this point, because a lot of people, depending on the severity, majority of the times they're either seen on a monthly basis or they're seen every other month, and if they're extremely stable, then they're going to be seen once every 3 months or so. So it's one of those things like, will therapy be beneficial if you only see them once a month? Will therapy be beneficial if you only see them once every 2 months? And that thing comes into play, especially depending on where you're working at. But there are also instances where if you have your own private practice, or if you work for one of those boutique offices, then you'll be able to provide both the medication management side and therapy, and you'll be able to bill a lot further, or you're able to bill on a weekly basis and see them on a weekly basis, and you're able to provide that therapy. One thing I do recommend, especially for people that are just becoming nurse practitioners, they came from a psych nursing background and they want to do therapy, I would recommend other resources in terms of doing therapy. I'll link down below the book that I use for therapy, but in this instance, I think it's a matter of you learning yourself and taking those educational courses, especially when you want to do like CBT, motivational interviewing, DBT, things like that. I feel like as long as you have the motivational interviewing component down packed in terms of being just a normal psychiatric nurse practitioner that does medication management and incorporating some motivational interviewing and learning the basis of cognitive behavioral therapy, it's important because if you want them to get better and you want them to see a therapist and you don't want to provide that therapy, at least you have the basis to prepare them and get them ready whenever they are going into therapy. So definitely take that in consideration. So just to answer your question, yes, psych nurse practitioners can provide therapy, but how educated or how well do you have that knowledge base in order for you to provide therapy? And if you want to be strictly providing therapy and doing some medication management, I would suggest either looking for a boutique nurse practitioner or psychiatrist or mental health office, or opening up your own practice, because you'll be able to have that justification on whether you're seeing them and how often you see them, what you're doing with them, things like that. If I were going to say the most complete package for a nurse practitioner or psychiatric nurse practitioner is having those two components and building upon that with the patient. Things you can do is just get more experience in providing that therapy, take those additional courses, take those additional certifications, because in the long run it's going to make you a better psychiatric nurse practitioner. Well, like I said, make sure you go and follow my Instagram and look at my posts for my contest. Contest ends April 8th, 2019. I'm going to be giving away these prescriber guides. I know this was a quick video, but I just wanted to give you a rundown on whether or not you are able to do therapy as a psych nurse practitioner, because I get this question so often, and like I said, there's two types of answers to this question, and I hope this actually prepares you and helps you answer this question. I don't know about other nurse practitioner programs, but mine particularly, they are incorporating therapy, but it's not to the certain extent that other therapists, psychologists, social workers are. The type of training that they receive, even psychiatrists, the type of training they receive is way more in depth compared to ours. So yeah, take that in consideration. If you feel like you just want to do therapy or you want to add that component, I would recommend just getting further training, more extensive training, and being certified in that training. So as always, have a wonderful day, guys, and don't forget to like this video, subscribe, and I'll see you guys next time. Bye!